We have created this video so you will be able to understand your role in a code red emergency. With hands-on training along with this video, you'll be able to assess and take control. This video is broken down into 5 categories. Number 1. Active fire alarm, putting race procedures into effect. Number 2. Command center, initiating code red procedures. Number 3. Dispatching officers to essential locations. Number 4. Assessing and taking action. Number 5. Code red alarm wrap-up.
Is on fire.
You're right. Let's get you out to safety.
Okay, I'll follow you.
All right, I'm going to have you come out. We're going to confine this room. If you can just step there to the right.
I'll stay right here.
We're going to get you over here to the side. If you could just sit over there for me for further direction.
I'll sit right here. Wait.
Okay, thank you.
Code red. Code red. Mr. Firestone is now in effect. Code red. Code red. Mr.
Hi, this is
Firestone is
Brianna,
now in
RN on
effect.
Joint and Spine, 5th floor. I just want to report a fire up here in room 502. This is the
Code
north tower.
red. Code red. Mr. Firestone is now in effect.
Yeah, can you repeat that one more time?
Code red.
Yeah. Thank you.
Mr. Firestone is now in effect. Code red. Code red. Mr. Firestone is now in effect.
I'm in the Anne Arundel Medical Center. How may I help you?
You want me inside?
Yes, let me repeat this to you. Your name is Dawn. You're calling from the Edwards Pavilion, first floor lobby, and you have an electrical fire. Do I have that correct? Okay, thank you, Dawn. Please follow your race procedures. All officers, I have a fire at the Edwards Pavilion, first floor, electrical fire, Edwards Pavilion, first floor, and I'm heading to the fire panel. I saw no problems with the hug system. The Klattenoff doors were secure. Button should be silencing the alarm.
Turning on control, alarm is silent.
Officer on duty tells me the alarm is silent. Okay, if we look at the fire panel, in order to reset, I'm going to hit the reset button. Notice the alarm is solid red because it's engaged. The yellow light is on because the alarm is silenced. Let's try the reset button. Push and release. It takes some time to churn through. Notice now the alarm button has gone away. Notice now the reset button has gone away and the alarm silence button has gone away. Our fire panel has been reset. All right, when we're responding to a fire, it's important to know the locations of our fire extinguishers and to bring a fire extinguisher to the scene of the fire. So I'm coming to this box. I'm going to use the hammer and break the box and then bring the fire extinguisher to the scene. Fire extinguisher from the cabinet, I come to the scene of the fire and I set the fire extinguisher down. We use the PASS acronym. Pull means pull the pin. See this tab? I've snapped that off. I pulled the pin. This will allow me to use the trigger. I'm going to remove the nozzle. Again, I'm going to face the front of the fire and sweep and spray. Note that I'm spraying in front of the fire. By spraying in front of the fire, I've allowed the dry chemical that we use to roll over the surface of the fire and smother it, taking away the oxygen. Once the fire is out, it's very important that this fire extinguisher that has been discharged be replaced. So immediately at the end of the fire, it's important that we as the responding officers keep track of the expired and discharged fire extinguisher, remove it from the scene and replace it immediately with a newly charged fire extinguisher. This will then be documented on our fire extinguisher sheet, and a call to engineering to have the fire extinguisher recharged will take place after the event. This is a pretty typical fire pull station that we have in our hospital. It's red, it's wall mounted, it's key operated, and what a staff member would do in the event of a fire would stick their hands in here and give this a yank. By pulling down on this plastic handle, it's going to rock a toggle switch up and put the alarm system into active status. I'm going to open this up for you to see how it looks. All right, I'm very gently going to open this up. I don't know if you can tell, but there's a toggle switch that is in the down position here. And if you see, underneath it is the word normal. That tells you that the normal position of this toggle switch is down. When the trigger is pulled, this toggle switch is going to flip up. So when it comes time to reset a pull station, you need to first return the toggle switch to the normal position. Use your hand to hold in the plastic trigger and slowly close the pull station. The pull station now has been reset. If I were to grab and pull the trigger, the toggle switch would flip up. You want to remember that the small brass key on our key rings has the letters CAT45. It's going to work the majority of our pull stations. The Edwards Pavilion has pull stations that are spring mounted. Instead of a toggle switch, pulling this out allows the whole housing to drop out and a spring operated button pops out. To reset that, you simply close the thing and reset it with your key. And then there are a few pull stations that actually have a screw at the top. It's pressure sensitive. Pulling this down, again, activates a spring-loaded button, and then when you close it, you just twist the screw a little bit, push it shut, and then reset it that way. It's important to realize that we have 3 different types of pull stations. Be familiar with the operation of all 3. Yes, sir.
Code red. Mr. Firestone is now in effect.
I didn't know if you heard me. I'm clear for the floor. You're recording there. Please say you're talking about it.
Code red. Mr. Firestone is now.
An important piece of paperwork that we use in our Code Red exercises and in responding to an actual fire is the Code Red evaluation form. This is a tool that security officers use to document the activity during a Code Red and for training purposes to document the actions of the staff if there's anything they may need further education on. The first part allows us to note if it's an actual fire or a drill. It gives us the date, the time, the pavilion, the floor, and the unit, and the cause of the alarm. We will note here, was a fire alarm pull station activated? Was it a smoke detector that caused the alarm? And was security notified by telephone? We need to know the time the fire department arrives on the scene if it's an actual fire. That time, of course, is not needed for observations during a fire drill. We have spaces to list the names of those that respond: security, nursing staff, environmental. Any hospital staff that were a part of the fire exercise will list their names. Then we have some other questions to ask. Was a fire extinguisher brought to the scene? Here we see a fire extinguisher cabinet with the fire extinguisher inside. We're hoping that comes to the scene of the fire in the hands of a trained staff member. Did the fire alarm system work properly to allow fire doors to drop? These are magnetically operated doors that will drop in the event of an actual fire, confining the fire and keeping our patient staff safe. This is an important question to follow up. Did this operate properly? We want to talk to the staff members that responded and make sure they were familiar with the RACE procedures: remove, alarm, confine, evacuate, or extinguish. That is how to act in the event of a fire. And were the staff members familiar with the PASS procedure? When using a fire extinguisher, do they know to bring it to the scene of the fire, set it down, pull the pin, aim at the base of the fire, sweep and spray to extinguish the fire? We would want to note any other equipment that was brought to the scene of a fire in the event of an actual fire. This may be fire equipment bringing axes. They may bring heat sensing devices. They may bring fire hoses or fans to evacuate smoke. That sort of information will be noted on our sheet. Having noted all of this information, we then need to ask the staff some other questions. Have we observed that all patient room doors are closed? Is the staff aware of their evacuation procedures? Are they familiar with their routes of evacuation? Do they know to use stairwells and not elevators? Do they know the location of their pull stations and their fire extinguishers? Most staff have a known point of assembly. With nursing staff, they're probably going to move with their patients, but other departments need to have a place where they meet to receive instruction from their leadership. And are they able to identify a point of safe refuge? That would be on the opposite side of fire doors from the fire. If the fire is behind these fire doors, a safe refuge would be here. If the fire is in this area, safe refuge would be behind us through another set of fire doors. This is the kind of information that we will be asking during a fire training drill or in the event of an actual fire. The last but very important part of our Code Red evaluation form is a space here for fire department comments. The responding officer is going to need to note the name of the lead firefighter, the captain or lieutenant who's in charge of the scene, the name of the fire company that responded. We might say Lieutenant Kitchen from Tower 40 responded to the fire. He allowed us to cancel the Firestone, the Code Red, and the time that he told us to do that. There's also a spot here for any comments. The fire department may say we need to have hazard rounds and life safety rounds in this area until a certain situation is corrected. There may be comments that no patients may return to this area until it has been thoroughly cleaned. Any kind of detailed information that responds or is needed for us to respond can be listed here. The time that the fire is secured, and of course the name of the security officer who is on scene filling out this form. Thank you. Okay, we were talking about the Code Red evaluation form. That's going to be filled out by the initial responding officer, who is that lead officer for the security department on site at the scene of the fire. But we have a second form. This is the Code Red observation form. This is the form that will be filled out by a security officer who will be moving to 2 floors above the location of the fire and 1 floor below the location of the fire. This is a sort of a simplified version of the last form. It's going to be a series of observations that generally are going to take place after the actual fire event or in real time during a fire drill. Same idea. It's going to list the date and the time of the fire, the location. But the location here, we are asking, where is the officer standing who is doing this observation, not the location of the fire. It's going to ask for that security officer's name, and then he'll be asking the staff these questions. Was the fire alarm system audible on your unit? What was the announced location of the fire? Were the fire and smoke doors closing properly? Were the patient room doors closed? Again, these are questions to ask after the event or observing during a drill. We then have a spot for an interview with the staff, similar to the previous one. We ask the staff to talk about their race procedures. If not familiar with the procedures, did we give education? We ask the staff about their past procedures, pull, aim, sweep, and spray, use of a fire extinguisher. If not familiar, we give education. And we ask the staff to let us know their nearest emergency exit. If not, we give education. Note here there is a space to note were the exits monitored. Remember, in the Klatenoff Pavilion, due to the increased safety levels of our infant and pediatric units, we have nursing staff monitor those units during a drill to prevent any unauthorized movement through those doors. We will ask them for their assembly points. We will ask them how to mark a vacated room. Again, diagonal white tape on a closed door after the room is vacated. We will again ask them to give us the location of a pull station and the nearest fire extinguisher. At the bottom of the form is a place for the security officer conducting the interview to clearly print the names of the staff he interviewed, including their department, and then give any notations as far as further education, anything we can do to improve the safety of our staff in the event of a Code Red. Thank you. I received notification from the officer on site that the fire department has responded. The issue has been resolved and that the fire panel and pull station can be reset. I've asked the officer on site to reset the pull station. She has done so. The next step is to go to the fire panel and reset the fire panel. Alrighty, I've been back from the fire panel. I know that the fire panel is cleared and reset, so the last thing I need to do is make a Mr. Firestone Code Red no longer needed announcement. We use only Code Red now. Again, I'm going to press 771 for the overhead page. Code Red, Edwards Pavilion, first floor lobby is no longer needed. Code Red, Edwards Pavilion, first floor lobby is no longer needed. Note I use my finger to hang up the phone. It's a quieter way to do it. All officers be advised, Code Red is no longer needed. Edwards Pavilion, the fire system has been reset.